Hello and good afternoon. My name is Zulima Chavez, and I'm the Support Center Manager for the Asthma and Allergy Foundation of America, or AFA. This episode is produced independently by AFA and made possible in part by support from the American College of Allergy, Asthma, and Immunology. Today, we're talking about managing allergies during the summer with Dr. Jeffrey Demain. Dr. Demain is the founder of the Allergy, Asthma, and Immunology Center of Alaska, clinical professor at the University of Washington School of Medicine, adjunct professor at the University of Alaska, and the founder of the Asthma and Allergy Foundation of America Alaska chapter. Dr. Demain, welcome and thank you for joining us on today's episode.
It's absolutely my pleasure, Zalima. It's nice to be able to chat about one of my favorite subjects.
Yes, I'm looking forward to it. During the summertime, it's warmer and we spend more time outdoors. And with that, we are exposed to different allergens such as pollen, mold, and insects. Bees, wasps, hornets, and yellow jackets are common stinging insects that cause an allergic reaction. Can you talk more about the stinging insect allergy?
Right, we refer to that as Hymenoptera sensitivity. So Hymenoptera encompasses all those insects you mentioned, including fire ants. So fire ants important as well. And now what we call Asian needle ant is becoming a problem. These insects are venomous and they sting. And their antigen within the venom is a protein that people develop allergies to. So we call those major allergens. So during the summer, like you said, and spring when it's warm, you're going to have honeybees. You're going to have more wasp nests. Importantly, yellow jackets, which are oftentimes ground dwelling, is an area where a lot of people have stings. And certainly in the southern part of the United States, we have stinging ants, and that can be a problem. So these insect stings can cause anything from just a painful sight, which is kind of normal, uh, all the way up to anaphylaxis or a severe systemic reaction. So statistically, I've read that somewhere between 50 and 60% of the population will report a sting within some short period of time. So everyone or many people are going to get stung. Most don't have a reaction at all other than a painful sight, but some will have the allergy reaction.
Yeah, you mentioned anaphylaxis, the allergic reaction, and after being stung, a person could experience a life threatening allergic reaction, also known as anaphylaxis. Insect stings can also cause other serious symptoms that are not allergic, including toxic reaction and serum sickness. Can you talk more about those symptoms that people can experience?
Well, with anaphylaxis, which is one of the most serious events, this can occur within minutes to a few hours, and it can originally begin with maybe skin symptoms like hives or swelling, but then it can progress to more respiratory symptoms, difficulty breathing. You can have significant swelling called angioedema that can obstruct the airway, gastrointestinal symptoms like vomiting, nausea, abdominal cramping, pelvic cramping. And the most serious, of course, when we have cardiac events, loss of consciousness, drop blood pressure, and it can be fatal. Fortunately, fatality is not very common. We see somewhere between, the estimate is between 40 and maybe 400. We don't know, but at least 40 people a year will die from anaphylaxis from a stinging insect, but we think it's more than that because oftentimes someone may die on a tennis court and we don't ever know that they were stung. The other things you mentioned, the toxic reaction, that's really quite uncommon, and that is associated with a lot of stings. So if somebody were to maybe lose consciousness and there's a fire ant mound, then the fire ants may sting, 1,500 times. But it takes a significant level of sting in order to have a toxic reaction, which can include headache, nausea, vomiting, joint pain, fever. And again, fatality can occur, but it really takes a massive amount of stings for that to happen. It's not going to happen with even 20 or 50 stings. It's going to happen more with 500 stings. So it can occur, but again, not very common. The serum sickness reaction is a little different. It doesn't necessarily take a lot of stings for this to occur, but this is a combination of an IgG antibody and an IgE antibody. So we think about IgE as the allergy antibody, but IgG is more of the autoimmune antibody. So the serum sickness is more related to developing an antibody against the venom. And it occurs maybe 7 days after a sting, so it's not immediate. And those symptoms are very oftentimes joint pain. You can get rashes, you get fever, you get malaise, feeling like you have the flu. So the serum sickness is a little different than when we think about an allergic event, since it's more of a delayed event.
Yeah, that's really helpful to know as we spend more time outside. If someone believes they've been stung and they start to experience some of the symptoms, it's a good sign to go speak with their medical provider and seek care immediately.
That's right. Well, I think, again, for someone getting a sting and they get a local swelling, they don't need to
Mhm.
necessarily go seek care of that. But you can get, again, a small painful reaction is the most common. That's normal. But you can get a large local reaction that occurs probably in around 10% of or so. And large local reaction would be something greater than 10 centimeters, and that's about 2.5 inches. So you think about size. And it can be painful, but also very itchy because it is an allergic event. Now, the risk of someone having a large local reaction progressing to something more serious is uncommon. Statistically, about 5% of patients that develop large local reactions from insect sting will maybe in the future have a more severe allergic reaction. In Europe, that's reported closer to 7 to 10%. Not really sure why the difference, but in the United States, 4 to 5% is what we see. The next type of reaction that we see, you can have what's called a generalized cutaneous reaction. So this is developing hives, maybe some swelling of your lips or swelling of your hands. It's called angioedema. And if symptoms don't progress beyond the skin, they don't really need to be tested. They don't need to go on venom shots or anything like that. It is important, though, that if someone's developing hives or swelling for the first time, I think having them potentially see urgent care, but we usually treat that with antihistamines, and it's not a severe event. It doesn't progress very often. And then the final event that you mentioned is going to be anaphylaxis. Now that can occur again within minutes to hours. And when you have this type of reaction, there's oftentimes a feeling of doom that goes with it, that you don't have to have skin symptoms. So some people think, well, if I don't have hives, it's not allergy. But that's not true. In fact, some of the most severe events don't include skin symptoms at all. They just have trouble breathing, abdominal cramping, diarrhea. They can have vomiting, pelvic and abdominal cramping, lightheadedness, feeling of impending doom, and of course, loss of consciousness, often related to low blood pressure, is the most serious event. And those individuals need epinephrine now, very promptly. The sooner the epinephrine is given, the more effective it's going to be. And oftentimes it can take more than one shot. It may take two or three. So this is definitely a time that someone needs to seek out healthcare.
Yeah, definitely. And similar to insect stings, there are biting insects that can also trigger allergic reactions. And recently in the news, we've seen warnings about an invasive Asian needle ant spreading in
Mm-hmm.
the Southeast US. What do people need to know about allergies to ant and mosquito bites?
Well, ants, fire ant, imported fire ant is considered a hymenoptera. So they're in the same family as the winged hymenoptera like the yellow jacket or wasp. And it's actually technically a winged insect because the queen can fly. The others don't, but the queen can. And they sting. So the fire ant bites on with their mandibles and then they spin in a circle stinging. So they can sting 5 or 6 times. And the fire ants are going to typically be defensive. So if you're stepping on their nest, they're protecting their nest. But oftentimes, by the time you know you're being stung by a fire ant, you're stung by 20 because they'll swarm. They usually leave what we call a sterile pustule, so you'll get a painful lesion that'll develop a blister. Don't scratch the blister because it's fine. It's not infected, but it could get infected if you scratch it. And that's because of some of the alkaloids that they leave in addition to the antigen. But they can progress to all the things I just said. They can have, large local reactions. They can have cutaneous reactions, and they can have systemic anaphylaxis. The Asian needle ant is something that's relatively new. They came into this country around 1952. They're native to Japan and Korea and some of the other Asian countries, but they're moving up the southeast United States. And they're also a hymenopter, not hymenopter, but they also sting. So they can bite on and then they'll actually sting as well. We don't have a venom specifically for them as far as treatment or testing, although a recent data have shown that their antigen, what's in their venom is similar to what's in the venom of a yellow jacket, of a vespid. It's called antigen 5. So within the vespids, the antigen 5 is a common one, like that's shared between wasps, yellow jackets, and now we're seeing it in the Asian needle ant. But they have other antigens too, so you can't treat them like they're stung by a yellow jacket, unfortunately. At least there's no data to demonstrate that. But they can cause the same reactions we've talked about. The fire ant is also non-endemic to the United States. They were endemic to South America, and they came up in actually produce. They came up in azalea bushes, up into Mobile, Alabama, and also into Texas. That was their origin. But they're also moving up the East Coast and they're moving up the West Coast. And interesting, it appears that the fire ant are traveling under the highway so they can stay warm. So it's a slow travel, but they're doing it, and they are making their way up both coasts.
Wow, I'm learning so much already from this conversation. And in addition to, stinging insects, biting insects, another thing we see that comes up in the summer is pollen. And
Mhm.
tree pollen gets a lot of media coverage in the spring, but in the summertime, it can also be problematic for people with a pollen allergy. In the summer, grass pollen peaks, and then in the late summer, it is weed pollen season. And in warmer parts of the country, people can experience pollen allergies symptoms all year round. And Dr. Demain, can you talk about what symptoms people should watch out for and how they can best manage their allergy symptoms?
Right. Well, exactly what you just said. I think understanding what they're allergic to is the first step. And in the spring, we have tree pollen cycles. So it's in the spring, it's trees. It merges into grass during the summer and then into weeds. Most predominantly in the United States, we see ragweed, but there are several different weeds. And so when you're having symptoms during those specific seasons, you can say, okay, it's the tree pollen. That's the time that maybe I shouldn't be outdoors as much during the day. When your trees are going to, when they pollinate, they tend to cycle. So you can have tree pollen cycles in the morning as well as the evening. So keep doing things like, keeping the door shut, closing the windows, so the pollen is not coming in. Maybe spending a little less time outdoors. Midday is actually going to be the best time outdoors. And then during the evening and the morning is probably where you're going to have your higher pollen levels. So take an opportunity to monitor the pollen levels that you can go to the National Allergy Bureau, and most cities are going to have pollen levels on the newscast where you can access it as well. The other things that you can do is take antihistamines. That can be very helpful, and that would be like over-the-counter medications like cetirizine, loratadine, and fexofenadine. I won't use their brand names, but and then you can use a nasal spray, one of the nasal steroids, and that can really help as well. Something else that's important, I think, is when someone comes in from working outdoors or playing outdoors, I would say change the clothes before coming through the house because you can bring those pollens into the house, and then you've taken your area where you think is pollen free, and now you've brought pollens in. So pollens are very airborne. The grass pollens can be a real problem. Children oftentimes are rolling around in the grass, and they can develop hives just from touching the grass. So be aware of that. And again, if that happens, it's going to be transient. It's going to go away. But a little bit of cortisone cream can sometimes help that on the skin. And then weeds, of course, you already mentioned, that's going to be, in the fall. So understanding the seasons, I think, is important. Understanding what you're allergic to is important. Using some simple over-the-counter medications initially, but ultimately seeing your allergist to really identify what am I allergic to and what are my best steps for management, because there may be asthma associated with that as well. That's going to require medications that you're not going to buy over the counter.
Right. Yeah. And for me personally, I know the summertime can be challenging for my asthma and my allergies. So I'm taking notes of different things I want to do differently. Going for walks. I love going for walks. So knowing to check the pollen counts before I go outside, or the best time would be around noon, are very important things to take away, and preparing, taking steps to make sure that you are preparing and for the summertime, the different allergens and triggers, as well as maybe changing some things around in your routine in preparation for those additional exposures that you may experience. And speaking of pollen, some of our listeners may have heard of the term allergic asthma. Pollen, among other allergens, can trigger asthma flare ups. What is allergic asthma?
Well, that's a really good question. Allergic asthma is a common term, but we break asthma into different phenotypes is what we call it. So we're looking at different kinds of asthma because that allows us to do a better job managing because management's different depending. Allergic asthma is what we call a T2 high asthma, or it's related mainly to IgE antibody. We talked about allergy. And this is actually the most common type of asthma we see in children. And so someone that has this allergic asthma, they're exposed to those pollens, their asthma exacerbations or asthma attacks can really be quite significant. So it's going to be associated primarily with an allergen exposure, but people with allergic asthma can also have trouble with running. They can have trouble when they get a cold. So other things can trigger it as well. But I wanted to add something that we also know that air quality in association with the pollens is going to significantly intensify the immune response. So now we're seeing a lot of smoke through the United States coming down from Canada. So when you take that smoke, add it to the pollen, that aggregates it. They kind of bind. So you get this really severe, intense immune or inflammatory response in the lungs. So be aware that that's something that can make it worse. Again, running, if someone's playing baseball during grass season and they're running the bases and they're out running in the field, again, that can intensify the type of reaction that they have. A lot of open mouth breathing, right? So think about that as well. And I wanted to make one other comment if I could, and I missed it before, but HEPA filters I think are very important. HEPA filters are filters that can pull these small allergens out of the air. They can actually filter out any type of any type of micron, any type of particle down to 0.03 microns, very, very small. So they can, really down to almost the size of a virus. Now, these freestanding filters that don't, or freestanding, they call them filters, but they're not. Their ozone generators are not helpful. In fact, they can make matters worse. So the HEPA filter, HEPA, is what's important. Sorry, I didn't mean to go back on that, but I hopefully
No,
I
that's
answered both
great.
questions.
Yeah, I'm really glad you mentioned that too. We have a resource that I like to share. It's our Healthier Homes checklist, and we'll include that in the description box for our listeners to review. But we put together a list of different steps that people can take to improve their indoor air quality, address triggers and allergens in the home. And among there, we've included tips like using an air purifier with a HEPA
Right.
filter, which is really important, especially now that we're seeing pollen, people are tracking it in, so ways
Yep.
to address that air quality inside and minimize allergens like pollen in the home.
Hmm.
And in addition, with pollen, there's also another phenomenon that many people in our community experience and may not know is linked to pollen. They'll describe having an itchy tongue or mouth after eating certain fruits and vegetables. What causes this?
Yeah, that's this referred to as oral allergy syndrome, also referred to as food pollen syndrome. So when you look at a pollen grain, I'm going to use birch as an example. The most major allergen in birch is called Bet-V1. Well, when you look at Bet-V1, it's a very specific protein peptide. So if somebody's eating a fresh apple, or they're eating a pear, or they're eating a cherry, or even some of the tree nuts can be associated with it, you look at those peptides and they have a peptide that's referred to as profilin 10. Well, bet V1 and profilin 10 look very much alike. So when someone's taking a bite of that apple, the immune system recognizes that they're just eating a handful of birch pollen. But fortunately, most of those peptides are broken down by acid. So we don't see generalized systemic reactions very often. By the time the acids in our stomach, for example, see that peptide, it's gone. It disintegrates it. So it's not really getting disseminated throughout the body. So most time, in fact, that only 2% of the time, if somebody has that oral allergy syndrome, will they progress to something more than that itchy tongue, itchy mouth. Sometimes maybe swelling can occur. Sometimes, again, maybe localized hives. But about 2% of the time, they can have a serious event. I've seen it here, especially when cherries come out. That seems to be the worst for us. And it's during birch season. We've had to have 2 patients life flighted in because they had such severe reactions. So it can occur. So I recommend being cautious. If those fruits or vegetables are cooked, then the peptides are broken down. So it's very safe to eat. So that fresh apple that you really love may not be on your plate today, but you can have applesauce or apple pie or anything where the apples are cooked. So that's kind of the summary of that. We see it with other things. You can see it with grasses, like with tomatoes that cross react. We see it with weeds, and that's going to be things like melons, for example, would be a good example, probably the best example of what can cross react with weeds.
Yeah, definitely a lot of things for people to think about if you're noticing symptoms when you're eating certain raw fruits or vegetables. This is a great time to check in with your doctor and talk about the different symptoms you're experiencing, preparing for the allergy and different pollen, what antihistamines should you take, what treatment options, and having a plan in place to address those different
Hmm.
symptoms. And I'll also add, so we talked about pollen, we talked about the insects. Now I want to pivot to climate change. We've talked about this and its impacts in previous episodes, and rising temperatures caused by climate change have led to longer allergy seasons and poor air quality. It also has an effect on respiratory health and the pattern of insects. What
Hmm.
are those impacts and how does it affect people with asthma and allergies?
Yeah, I'm living at the point of the spear when it comes to climate change in Alaska. We're witnessing it literally every day. So it does, there's a few things. So let me start with one thing that's happening. We're seeing longer and longer seasons. Spring is beginning earlier, fall is ending later. And with that, we're seeing, again, with those longer seasons, higher levels of pollens. And not only can it make allergies worse, there are data that support the fact that people that may not have become allergic are becoming allergic. So it increases the prevalence of people developing allergies to these environmental factors. When we look at the combination of heat and carbon dioxide, that plays a very pivotal role. So it's not just a matter of a longer season, which is absolutely demonstrated, up to 27 days longer, for example, in the United States. But when you look at the pollens themselves, the plants produce a lot more pollen in the presence of higher carbon dioxide. So you've got higher levels of pollen. Then in addition, when you look at each pollen grain has more allergen in it. The study's been primarily done with ragweed. The major allergen is called Amb1, but when you look at each individual pollen grain, there's going to be more Amb1 in the presence of higher carbon dioxide versus, where we were, say, even 20 years ago, or certainly prior to the Industrial Revolution. So it's really important to know that this is going to get worse. It's not going to get better. So be aware of this. As far as what can we do, it's the same steps. Can we mitigate? Can we go in and eradicate ragweed? That doesn't work, I'm afraid. So we're not going to do that. So we're probably going to have to adapt more than mitigate right now. But with that, I want to come back. I don't know if we're going this direction. I don't want to forget allergy shots because allergy shots are important. Venom shots, we can treat the sting insect with venom immunotherapy. It's 98% effective. I mean, it's a very effective therapy. Most patients can do it for 3 to 5 years on a monthly basis, and then they're done. And then the same with treating those pollens. If you're allergic to tree pollen or grass pollen, weed pollen, you can get allergy shots for that as well. And again, it's very effective. Usually within 3 to 5 years, you can stop the shots. And it also helps that oral allergy process as well. But be aware, we haven't talked about EpiPens. I don't know if we're going to talk about epinephrine or not, but that's also important for people that have more systemic reactions. It's critically important that they carry epinephrine of some type, whether it's nasal or shots.
Yeah, and on that note, with all of these potential triggers this summer, it might be helpful for our listeners to create a summer health plan. So, this is a great time to visit their healthcare professional and talk through the different treatment and management steps that they can do. Dr. Demain, what are some steps that people can take to prevent allergic reactions or asthma flare ups and minimize their exposure to allergens and triggers during the summer?
Well, that's a lot to unpack, actually, Zalima. So let's start with being aware of your allergen
Mhm.
and trying to minimize exposure in the way of pollens. If you have a food allergy or the oral allergy syndrome, maybe not eating those foods. And if you're allergic to insects, be aware of the environment where you find them. Again, yellow jackets are going to be mainly ground dwelling, although we have them also, they can be in nests that are in shrubs. Be aware of wasp nests that are going to typically be under the eaves of a house, is most commonly where we see those. Hornets are going to be also like in a bush. That it's kind of funny. Yogi Bear always gets a hornet's nest on his head, but it's not honey, so he's missing the point. Yellow. When you look at honeybees, almost all the honeybees we see are domestic. So if you're seeing a lot of honeybees, there's probably hives, domestic hives somewhere within about 3 miles. So again, be aware of that. Don't go barefoot when you're walking around outside. I think that's another important one. If you do have severe allergy to insects, wear long sleeves, wear long pants, and again, wear shoes because that's going to be your greatest protector is the clothing. And then if you're allergic to insects, we didn't talk about mosquitoes. I'm happy to go back if you'd like, but using an insect repellent like DEET, you don't need to use anything higher than 30%. So don't get the 100%. It's not going to be any better than the 30%. And then there's permethrin and other products if you don't want to use the DEET. They're not as effective, but then they're going to have to be reapplied every couple of hours. Regarding the pollens, awareness of the seasons you have problems with, keeping the windows shut during that time, using the HEPA filters, change your clothes when you come in from outdoors so you're not dragging it inside. And again, using the over-the-counter medications, I think it can be very helpful. The antihistamines, nasal sprays, and then also consider, allergy immunotherapy. And beyond that, with asthma, asthma requires management by your healthcare provider and need to do breathing tests to assess the level you have of control. You may not feel symptoms, but you may have obstruction and inflammation. So we have inhalers that can treat the inflammation and also open the airways. And we found more recently that using like the albuterol inhaler alone is not as effective as using maybe something like albuterol with a low dose inhaled steroid works a lot better. So using that combination. But there's maintenance therapies that are also required. Depending on the severity of asthma, there are personalized therapies. We call them biologics. So these are medications that work with your immune system to help turn off these inflammatory processes. And they do, there's many, they work in all different areas, and it's tailored to each individual person. And then we mentioned also allergy immunotherapy that can also be helpful. Eye drops, people have a lot of problem with pollens in their eyes. They're over-the-counter medications that are really quite good. I'm going to use a brand here. It's olopatadine, and the brand is Pataday, and that is very effective, and you can buy that at the drugstore. You can 1 drop in each eye, and 1 or 2 drops in each eye once or twice a day can really make a difference. There's another one that is ketotifen, or what's the brand? Oh, Zaditor. So that's really very good and can be quite helpful. And there's also topical antihistamines that you can buy. Using medicines like the vasoconstrictors like Visine, we don't recommend that. Using the vasoconstrictors in the nose like Afrin, we don't recommend that either. Certainly not using it regularly. If you use it occasionally, it's okay. But if you use it more than that, you can get in trouble. Hopefully that was a lot to cover, Zalima, but hopefully I hit on most of the high points there.
Yeah, that was great. You touched on a lot of great things for us to think of, and We do have a lot of great information on our website as well, so I'll include links for our listeners
Okay.
below and they could check them out after this episode.
Would you like me to talk about mosquitoes?
Sure, let's do
Let's do it. Well,
it.
mosquitoes, most people get mosquito bites. They itch. You get these little papules, and just don't scratch them. Antihistamines can help the itching. Using a topical steroid like cortisone that you can buy over the counter can help, and they're going to go away over a few days, and it's not significant. But some people develop what we call large local reactions, where it can get quite big, and even cross a joint. So it might involve your whole elbow or your whole wrist. And that can not only be really itchy, but also kind of be painful. That's going to take the onset. You can have initially that itching, but 8 or 10 hours later, you get this large local reaction. So it will progress and get worse over hours. And then it can last a week or more. So it can last a good long time. Topical steroids might help, antihistamines might help, but sometimes you require an oral steroid, and that's going to have to be based on the recommendation of your physician because that's a prescription and it certainly has potential side effects, but sometimes that's what we need for those large local reactions. There's another syndrome that's referred to as Skeeter syndrome. It's a funny name, but it's real and it's been adopted. And this is also a little different. It's more of a delayed reaction. But in addition to that large local swelling, you can have low-grade fevers, you can have joint pains, you can have rashes. You just don't feel well. So that's really kind of Skeeter syndrome. And again, back to the treatment, it's probably more seeing your doctor and getting an oral antihistamine. Anaphylaxis to mosquitoes is uncommon, but it can occur. Systemic events can occur. There have been some isolated case reports, really. There's one non-blinded study that was done that shows that there may be some benefit to using like venom, or not venom, but mosquito saliva treatment. But the only thing available, period, is testing to whole body mosquito. There is no mosquito saliva antigen. So it's not very sensitive for testing. It's not very specific for testing. And even doing blood tests is not reliable. So the point is the testing for mosquitoes can overdiagnose, underdiagnose, and the treatment is just not there. It's certainly not a standardized therapy, but people talk about it maybe, but it's only based on some scattered case reports. So it just doesn't have uh, enough data to really tell us it's something good and helpful. So not recommended. I don't know anyone that does it. And it's not FDA approved, and nor is it standardized. Okay,
Yeah.
there's mosquitoes.
Yeah, living in a humid state full of mosquitoes, it's not fun. So I have to be a lot more mindful of when I'm outside, making sure that I wear like pants or long sleeves just that I'm covered up or using some sort of mosquito repellent to avoid those mosquito bites. Dr. Demain, thank you so much for joining us today to discuss allergies and asthma in the summertime and steps that we can take to prevent allergic reactions and flare ups.
Well, you're sure welcome. This was fun. Let's do it again.
Yes, I love it. And I've learned so much, and it's given me a lot to think about for this summer.
Well, it's my pleasure.
We hope our listeners of the Afternoon Chats podcast found this informative and actionable. Don't miss our future episodes, and remember to like and subscribe to our podcast available on Spotify, YouTube, and now on Apple Podcasts. The information presented in our podcast is educational and not intended to provide individual medical advice. Please talk with your healthcare provider for advice about your personal health. If you have questions or want someone to talk about asthma and allergies with, our Asthma and Allergy Foundation of America online community is always open. You can find it at aafa.org/join. Before we say goodbye, we'd like to thank the American College of Allergy, Asthma, and Immunology again for their kind support of this episode. Have a good afternoon, everyone.